Hello, hi, good evening. Welcome to AccuCheck Wellthy. We are back again to discuss on set of new information, a new topic, series of knowledge sharing for all our AccuCheck Wellthy family. Let us all learn what are the new things we have planned for today. Meanwhile, let us wait for our entire AccuCheck Wealthy family to discuss on today's topic. Hello, Pramodji. Good evening. How are you? Thank you for joining. Hello, Mr. Chakravarti. Good evening. I hope you are well. Your blood sugars are under control now. Great. Thank you for joining before time. Let us wait for another 5 minutes and then we'll start with today's discussion. Meanwhile, if you want to update on what is the topic for today, if you want to drop in the questions even beforehand, please feel free to do so. Today's topic is unique. Today's discussion is um, a new discussion which was actually requested from many of you as a part of today's session. So let us understand this topic for today and let us see what are we going to learn today. Meanwhile, let us give about 5 minutes of time to our members so that they can join our session. Yes, what's your plan for weekend? It would be great if you can share in the chat box. Any special plans for the weekend? It's rainy season. I'm sure some kind of favorite foods, some kind of vacation, picnic, rainy trekking, any of such things could be in the plan. In case if you have anything in mind, feel free to discuss in the chat box with us. We have few more guests who have joined. Hello, Mr. Terkhedkar. Good evening. How are you? I'm so sorry. I apologize. I have a little sore throat and some cold. So, in case if my voice is a bit slow or has some fluctuations, but I will ensure that the topic is clear and understood by all of you. Hello, Harshal ji. Good evening. How are you? Hello, Sanjeev Nagpal ji. Good evening. How's your health? Great. And with this, without taking up any more time, we'll start with today's discussion. Today's discussion is one of the things many of you have been asking me about over the period of days. This is something which all of us are eager to know. So let us understand behavior therapy in diabetes management. What is it exactly about? What are the strategies? What do you mean by goal setting? What is managing your stress? Problem solving, barriers, cognitive behavior therapy, social support, addressing unhealthy habits, diabetes, and mental health. Let us learn what are these behavior habits or behavior therapy routine which each one of us needs to keep as a part in our current day-to-day activities. So there are three things which we need to understand. One is the key components, one is the habit formation, and one is the psychological impact. Okay, we'll discuss about this in detail. Let us understand the behavior strategies. Healthy eating habits and meal planning are essential for managing diabetes. It involves making nutritious food choices, portion control, carbohydrates, protein, and fat balancing. I'm sure we have learned the technique of balance plate. Okay, just to reiterate, palm full of carbs, handful of protein, thumb, the first side of the thumb would be your fat, finger size would be your any kind of support food. So all of these things we have learned in our behavior therapy, in our balance plate, but utilizing it in your day to day routine is very very important. And only diet is not going to help or not going to work. We need to have regular physical activity, because exercise plays a very important role in managing your blood sugars. How does it help? It basically creates a balance, or it reduces fluctuations in your blood sugar management. It improves insulin sensitivity and maintains a healthy weight. Monitoring blood glucose levels is important to track how different foods, activities, and medications affect blood sugar. It helps in making informed decision about diabetes management. Let us see the goal setting and self monitoring. गोल सेटिंग इज वेरी वेरी इंपॉर्टेंट. जैसे हमें स्कूल में छोटे बच्चों को हम सिखाते हैं कि जब तक आप एक्स नंबर या एक्स परसेंटेज या एक्स ग्रेड का टारगेट नहीं रखोगे, तब तक आप वो नंबर तक पहुंच नहीं पाओगे. Similarly happens in a scenario where your health is concerned, correct? So ensuring that every single time we plan or we set a goal and monitor it on a regular routine. So let us understand what is this all about and how is it going to help us. Yes? All right. Great. So let me tell you exactly what happens and what are the steps of monitoring. Okay. Tracking, simple thing. आप खुद भी ये ऑब्जर्व करो. अगर आप रोज आधा घंटा वॉक कर रहे हैं और अगर आप वो डेली बेसिस पे ट्रैक कर रहे हैं आपकी रूटीन में, on the days when you don't do it, that is you don't go for that 30 minutes of walking or 30 minutes of exercise, you will start missing it as a part of your routine. Why? Because now every single day you're used to doing this, correct? Hence it is important to understand tracking plays a very important role. ट्रैकिंग के वजह से काफी फर्क पड़ता है. किसी भी चीज का ट्रैकिंग हो, अगर आपको आपके वजन पे काम करना है, अगर आपको आपकी ब्लड शुगर, आपके कोलेस्ट्रॉल, किसी भी चीज पे काम करना है, ट्रैक इट. द you win 70% of the journey when you start tracking. Tracking is important. तो आप कहोगे मैं तो एक एक फल, एक एक फ्रूट, एक एक रोटी नहीं गिन सकता. तो हम आपको ये नहीं कह रहे हैं कि आप उसको गिनो या आप उसको चेक करो. द ओनली थिंग वी आर टेलिंग यू इज दैट जब आप कुछ भी खाते हैं या कभी भी ब्लड शुगर लॉक करते हैं, एक सिंपल फोटो निकाल के हेल्थ कोच को भेज दो या फिर आप अपने वेल्दी ऐप में लॉक कर दो. इससे क्या होगा? देयर विल बी अ ट्रैक मेंटेन, आपका रूटीन मेंटेन रहेगा, which will help you also and your coach also understand how is your overall healthy pattern, your eating pattern. Okay. मैनेजिंग स्ट्रेस एंड इमोशनल वेलबींग. स्ट्रेस तो काफी लोग बोलते हैं मेरा खाना तो बिल्कुल सही है, मैं योगा वगैरह भी करता हूँ, मैं एक्सरसाइज भी करता हूँ, मैं जिम भी जाती हूँ, फिर भी मेरा शुगर कम क्यों नहीं हो रहा है? तो द मेन रीजन फॉर दिस इज स्ट्रेस. ओके. स्ट्रेस impacts blood sugar levels, making it important to develop effective mechanism and relaxation techniques. By addressing stress and emotions, individuals can improve their overall diabetes management and quality of life. Seeking support from family, friends, and support groups can greatly contribute to managing stress and emotional well-being. Okay. बहुत ज्यादा इम्पोर्टेंट है. इसीलिए स्ट्रेस रिलीजिंग टेक्निक्स मैं आपको सिंपल चीजें बताती हूँ जिसके लिए आपको कोई खर्चा नहीं आएगा. घर के घर में आप स्ट्रेस रिलीव कर सकते हैं, आप स्ट्रेस का केयर ले सकते हैं। द फर्स्ट थिंग यू कैन डू इज हॉट ऑयल मसाज। अगर आपको पता है कल मुझे ऑफिस नहीं जाना है, या आप घर में ही है पूरे दिन के लिए, या कोई भी हफ्ते में एक दिन प्लान कीजिए, वन डे इन अ वीक compulsory you have to do hot oil massage. It relieves your stress. It releases a hormone which starts acting in your body. Okay, the oxytocin hormone. It is called as the happy hormone. ठीक है, तो वो आपके बॉडी में सारी जगह फैलता है। उसके वजह से क्या होता है, आपके जो मसल्स है वो रिलैक्स हो जाते हैं। यू फील रिलैक्स, your body feels relaxed, and because of this your ability to perform for the next few days becomes better. तो ऐसे बच्चे स्कूल के, कॉलेज के, जिनको कंसंट्रेशन की भी तकलीफ होती है, उनके लिए भी हम ये ऑप्शन बोलते हैं। दूसरी इम्पोर्टेंट चीज जो आप स्ट्रेस के लिए कर सकते हैं वो है सोने से पहले आपका कोई भी जो एक रिलीजियस आप जो फॉलो करते हैं, या ओम चैंटिंग हम उसको बोलते हैं यूजुअली इन हिंदू कल्चर, ओम चैंटिंग, जोर से आपको ओम, एंड यू हैव टू पुल योर ब्रेथ टिल द टाइम यू कैन, ओके, एंड देन यू हैव टू रिलीज इट। ये आपको सोने से पहले 5 बार करना है, 5 times before you go off to bed, and just before you go off to bed। मतलब जब, ऐसा नहीं है कि आप वो करेंगे उसके बाद टीवी देखेंगे, फैमिली के साथ बातचीत करेंगे, फिर उसका कोई फायदा नहीं। when you go on the bed, before you put yourself off, मतलब आप जब कुशन पे, बेड पे जा रहे हैं, उस समय से 1-2 मिनट पहले आपको 5 बार, अगर आप बिलीव करते हैं, आप ओम का चैंट कर सकते हैं, या आप सिर्फ हाई नोट पे ए बी सी ऐसे पूरे A to Z तक आप अलग अलग वॉइस टोन्स में बोल सकते हैं। इससे क्या होगा, it's very important to understand your body understands energies। ठीक है, इसीलिए अगर आप, आई डोंट नो कितने लोग इससे रिलेट करेंगे, बट हमारे जो दादा दादी या हमारे जो ओल्ड कल्चर्ड लोग हैं, वो who basically follow religious traits, they always tell us that do not say negative things at home, because that will impact on the way you think, the way you act, correct? So knowingly or unknowingly your body is getting the signals, okay? Your body is actually understanding every single word, every single action which you perform every single day, okay? Hence it is important that you do these things regularly। 5 times, आपको 2 मिनट भी नहीं लगेगा, बस ओम, you have to pull it and then calm it down। Do this for 5 days and tell me by next webinar, next Saturday, how is the impact? Did it help you get a good night's proper unbroken sleep? Did it help you relieve stress? Do share with your coaches and they'll definitely update me। All right, let's go to the नेक्स्ट इम्पॉर्टेंट थिंग। ये काफी सिंपल चीज है और हमें ये अपने डे टू डे रूटीन में पता होती है, लेकिन फिर भी हमें इसको करना बहुत जरूरी है। ओके, सो लेट मी टेल यू ये है क्या एग्जैक्टली। ओके, सो वेरी सिंपल थिंग, every single day, okay, when you wake up in the morning, you have to say 3 good things about your own self। Okay, this is called as affirmation or motivation or personal motivation। जहाँ पे हम क्या करेंगे या हम क्या करते हैं, हम अपने आप के बारे में 3 लाइनें या 3 शब्द अच्छे बोलते हैं फॉर दैट पर्टिकुलर डे। इट कैन बी एनीथिंग, जैसे आज आपकी कोई एग्जाम है, या आज आपके ऑफिस में कोई मीटिंग है, तो जस्ट अ सिंपल लाइन दैट आई एम गोइंग टू बी अमेजिंग टुडे इन द मीटिंग। ओके, क्योंकि आप तो आपकी दिनचर्या में या आपकी डेली रूटीन में व्हाट आर यू गोइंग टू डू टुडे, most of us are aware what is the plan for the next day, a day before. So at least if you do these things, it will definitely help you out. Do try these three things and share with your coaches how did it impact your health. Problem solving and decision making. Identifying challenges in diabetes management and finding effective solution. Making informed decisions based on your personal goals and your health coach advices and your doctor suggestions, and developing problem solving skills. Okay, तो यहाँ पे मुझे 2-3 इम्पोर्टेंट चीजों का जिक्र करना है, डिस्कस करनी है। सबसे पहले तो आपका जो अप्रोच है या आपका काम करने का या जीवन जीने का जो तरीका है, वो हमेशा वेरी वेरी इंपॉर्टेंट नॉन कंप्लेनिंग होना चाहिए। आप ये ट्राई कर सकते हैं, ये मेरा खुद का पर्सनल एक्सपीरियंस है विथ माय पर्सनल पेशेंट्स। एटलीस्ट फॉर 24 आवर्स इफ यू गो विदाउट कंप्लेनिंग, कोई भी चीज कितनी भी दिन में बुरी चीजें आपके साथ हो या कितने भी चैलेंजेस आपको आए, आप एक भी चैलेंज, एक भी चीज का आप कंप्लेन नहीं करेंगे। यू विल नॉट कंप्लेन इवन फॉर 1 microsecond in the entire day of 24 hours. Try this because this is something which is very very important, and this actually creates an impact because we feel that, oh, this is so small, how is it going to change, how is it going to improve, and how is it going to help on ensuring that things are going to be better. Okay, so that is something which will create an impact in your routine, and we need to ensure we do that. Okay, that's the first step of problem solving. The actual step is identifying the challenges. Okay, could be any challenge. डायबिटीज मैनेजमेंट के केस में अगर आप देखते हैं तो आपको पता है कि मैं घर में हेल्दी खाने का ऑप्शन नहीं रख सकता, या मेरे घर में देर इज नथिंग विच इज कुक्ड सेपरेटली फॉर मी, or there is no help who can make it, or I stay alone, cooking is an issue, or I work for 10 hours so I cannot exercise. Okay, so uska alternative dhondo, try to solve that issue, try to find a solution to the challenge, to the problem which you are facing, rather than complaining about the issue or complaining about the problem you are facing. um, this is genuine and this is important because this is something which creates our mental ability to find solution, to find a answer to the question. Okay, and sometimes we know what we are supposed to do, but we get engrossed in so much of negativity around us, or we get so much engrossed in our own thoughts कि ऐसे नहीं होगा, ये होगा, ये गलत है, वो गलत है. All of these things we actually do not get time to focus on these things. Okay, so these are simple basic things. If we try and focus on them, they are quite easy and can be managed, especially in diabetes management when it comes to planning your diets, planning your routine, creating a plan with your coach, creating your exercise routine, taking care of your family, and then working on your blood sugar, parameters. All of these things are important. Okay. All right. Moving on, let's see what's the next section. Overcoming barriers. We have discussed this in detail, that how to take care of the barriers. Now let us understand a therapy which is called as cognitive behavior therapy. Okay. Now what is this? It is basically identifying that why are your thoughts, why is your thinking ability going towards negative impact. Okay. It is important that you understand this in context of diabetes management. निगेटिव बिलीव्स कि मैं कितना भी कुछ भी कर लूं, मैं कितना भी एक्सरसाइज करूं, मेरा वजन कम ही नहीं होता. Many females have this habit. अरे मेरा जेनेटिक ही है, everyone is healthy at home, so मेरा भी कम नहीं होगा, तो मैं कितनी भी एक्सरसाइज करूं. आपने क्या मिनिमम 3 से 4 महीने एक्सरसाइज की है? क्या अपने आप पे आपने काम किया है? करेक्ट. without even taking effort, how can you say कि होगा ही नहीं? Okay, that is a behavior trait which we need to ensure is not seen in our diabetes management journey. Okay, instead you can think, my mother, my sister, my family couldn't do it. Maybe if I try, I would be able to do it. Correct. So don't push everything always on genetics, family traits, routine traits. Okay. You need to ensure that you as an individual can still overcome it. Okay. Next important thing is self management, self behavior. अगर आपको खुद पे काम नहीं करना है, तो आपने वर्ल्ड की बेस्ट न्यूट्रिशनिस्ट को भी हायर किया, आपने वर्ल्ड के बेस्ट ट्रेनर को भी हायर किया, आपने सबसे एक्सपेंसिव मैनेजमेंट प्रोग्राम लिया, आपका कुछ नहीं होगा, कोई चेंज नहीं आएगा रूटीन में. क्यों? क्योंकि आपको खुद को ही उस पे काम नहीं करना है. सो लेट मी टेल यू दिस अगेन. If you want to help yourself, only then you can take help from others to reach to your ultimate goal. Planning your goal is very, very important. Please ensure you do it even for small situations. Example, I am going to a party, and when I come back, I will not have weight put on. I will eat accordingly. Okay. So this is basically, can be short-term goals, can be small goals, can be any kind of routine habits. Social support and accountability. This is actually the role of many people's wives who are here today, and many people on their own, okay, who are taking care of their health. Having support and accountability is important. If you need somebody to push you other than your health coach back at home, this is something which will create an impact from your loved ones. Addressing unhealthy habit. Stop complaining. Identify the habit. आपको पता है आप स्मोकिंग करते हैं, आपको ये भी पता है कि स्मोकिंग करने से हार्ट अटैक आता है, कोलेस्ट्रॉल बढ़ता है, डायबिटीज बढ़ती है, ब्लड प्रेशर बढ़ता है, लेकिन फिर भी आप स्मोकिंग करें. तो आइडेंटिफाई व्हाई इज द रीजन, व्हाट इज द प्रॉब्लम, व्हाई एंड व्हेन डू यू स्मोक. Are you in office? When you take breaks, do you smoke? When there is some physical exertion for the entire day, then do you smoke? So identify exactly what happens and then try to work on it. Diabetes and mental health. Diabetes has a significant impact on mental health. showing higher rates of depression and anxiety among individuals with diabetes. Strategies for improving mental well being include practicing self care, engaging in stress reducing activities, and building a strong support system. It is important to seek professional help when needed to address mental health challenges as they can negatively impact diabetes management. All right. Yes, and we are here. I'm very happy and pleased to share this information with you. We are now a family of 1,25,000 users and we are growing day by day. Okay. I will give you next 2 minutes of time to think about the questions you have in mind. कुछ भी है जो बिहेवियर थेरेपी बिहेवियर मैनेजमेंट के बारे में आपको पूछना है, मेंटल हेल्थ, अनहेल्दी हैबिट, सोशल सपोर्ट, कॉग्निटिव बिहेवियर, बैरियर्स, प्रॉब्लम सॉल्विंग, डिसीजन मेकिंग, उसके बारे में आप पूछ सकते हैं. फील फ्री to discuss about any kind of questions you have. Yes, looking forward to the chat box. Do drop in your queries. Great. I have a question. I have anger issues. Okay. So, Tarun ji, good evening. सबसे पहले तो, thank you so much for joining today's session. You need to talk to a psychologist because he will help you with anger management techniques. There are few techniques, but to start with, before you get an appointment, you talk to your doctor. To start with the two things I told you for stress management. If you can manage your stress, the next step is anger management. Okay. So start with step one and then you can go to step two by consulting a help. Please feel free to drop in your questions in the chat box. What about deep breathing? Hello Vivek ji, good evening. Thank you so much for actually having your presence, and thank you for joining today's session. Let me tell you this. It is a great technique. Deep breathing helps relaxes your internal system because breathing activities are similar to yoga activities. Hence, it is you know it is essential to understand this, that but it has to be regular. अगर आप कहेंगे मैं हफ्ते में 2 ही दिन करूंगा, that will not cause any impact on your body. Okay, so minimum 5 days a week is advised, and that also proper 15 to 20 minutes of deep breathing. Yeah. All right, let me see the next set of questions. Yes, I have few more questions. Harshal ji, hi, good evening. Okay, if there is work stress, how to avoid it? Great. So, there is a book which comes in the market. Okay, um, it's called Daily Planner. Okay, so there are two things when you say work stress. Number one, It is related to the amount of work you do, and it is extensive. Basically, it goes beyond your daily working hours. So that needs to be pre-planned, and actually saying no where it is required is essential. I know it may not be always possible, but at least on the situations where it is creating a mental impact, work needs to be controlled. Next thing is that every 100 minutes, matlab every 1.5 minute, 1.5 hour, you have to take a 5 minute break. ठीक है, तो ब्रेक मतलब ऐसा नहीं है कि आपको पूरा आपका लैपटॉप या काम बंद करके यू हैव टू मूव ऑन. Just get up on your place, just relax your muscles, go around. Maybe you just freshen up or go to the loo, or do basic things, and post that you can resume back to your work. So every 100 minutes, so your brain ability, this is a scientific fact, this is a scientifically proven fact, your brain's ability to focus at a stretch is 20 minutes, and maximum brain focuses back to back for 5 repetitions, and 5 into 20 is 100 minutes. Okay, so not beyond 100 minutes you will have focus attention, focus concentration. So after every 100 minutes, break the chain, break your thoughts, get up, talk to somebody, go around in the office or at home, try to do something else, have a glass of water, sip something, eat a bite of something, or just go around in the house, or any of these things can be done. And then you get back to work so that your thoughts are refreshed, the earlier concentration chain is broken, and now you're again forming a new chain. Okay, so what happens again, your level of concentration improves. Okay, all right, let me move on. I have few more questions. Hello Sanjeev ji, good evening, thank you for joining today. Is screen time reduction also helpful to reduce? Absolutely. I think the biggest issue today is the screen time, and screen time has to have a limit, a cut off. एग्जाम्पल जैसे एटीएम में एक दिन में एक ही बारी में 25,000 का ही अमाउंट आप निकाल सकते थे, उसी तरह से आपके स्क्रीन टाइम का भी डेली कट आउट टाइम होना चाहिए. I will not watch any form of screen for at least 4 hours other than my sleep. Okay. Uh, Create your self challenge. Create your self routine. Create a goal. So Sanjeev ji, you can actually create a goal that in the entire 24 hours in a day, I will only give 2 hours of screen time. Can be anything, can be phone, can be TV, can be laptop, any kind of screen time of not more than 2 hours or 3 hours, or 50% of your current. That has to be your ultimate goal, and that has to be done and followed every single day. All right, let's move on to the next question. Hello Yadav ji, how are you? I hope you're doing well. After diabetes, I hesitate to interact with strangers. Even after a few meetings, it's very difficult to establish a quick rapport and a reliable bond. I don't know why so. It has no relation with diabetes to interact with somebody, but yes, it can be related to anxiety or any kind of mental concerns. I will suggest go to your psychologist, or if you are not aware, talk to your doctor. He will recommend you to someone, and then you can discuss it. Okay, all right. To improve dopamine levels, I think that's the key. Sanjeev ji. Hello, Sanjeev ji. Thank you so much for sharing that. We will keep your suggestion in mind. Hello, Mr. Chakravarti. I can see a question from you. Is regular activity maintained and restricted as per the age, or you can set a particular goal every day? Yes, the more you do, the better. It should not create any impact on your other crucial organs. If that is happening, definitely no problem, no challenge, no issue. Regular activity can be maintained and restricted. Okay. How to improve memory power at 60 plus age? चंद्रशेखर जजाजी. Okay. जजाजी, सबसे पहले तो memory is something which can be worked upon for a longer period of time, but just to help you understand in foods, in terms of nutrition, that actually have you actually have your routine, and you actually have your day-to-day activities, in which you ensure that you have enough of vitamins. Vitamins are essential for this, and consuming them every single day is required. Okay. Yes. Let me go to the next question. I'm taking high dose medicines for diabetes. Now maintaining diet and using methi, jeera, chia, water, and may fall the sugar level. Please suggest how balanced medicine or withdrawal. Hello Sudeep ji. I'm so sorry. I am not a doctor. Only a diabetologist can recommend diabetic medications, reduce the dose and work on it. But one thing I can suggest you, go and meet the doctor with your reports, with your readings, because that will help reduce your sugar level, sugar tablets based on your levels. Okay. So please do that, so that there are no problems or challenges faced, and you can easily reduce your medication once doctor approves. All right. Okay. Any more questions? Please feel free to discuss. No? Okay. Just give me 1 minute. I have to show you how does behavior actually impact, and this is a lovely series, a small message which I want to share with all my fellow Active Check Wealthy members. A very good video which will help us understand exactly what happens. Just give me 1 minute. I will share this.
In their limbs. They may develop liver and kidney disease and are at risk for stroke and heart attack. However, Type 2 diabetes and prediabetes can be avoided and risk can be reversed. What is diabetes? Diabetes is a complex disease that affects many parts of your body, but is caused by the way your body mishandles the food you eat. After a meal, food is broken down into sugar molecules called glucose. Glucose travels through the intestines into the blood, where it is carried to all different areas of the body and is used for energy. Some parts of the body that need help absorbing the glucose molecule and require a special hormone called insulin. Insulin is in the pancreas and circulate blood with glucose to the cells that need help. Specifically, liver cells, fat cells, and muscle cells. When the body develops resistance to insulin, increasing amounts of insulin are necessary for it to be able to utilize glucose. Initially, during insulin resistance, your pancreas will work on overtime to produce more insulin. This can happen even when your glucose levels are relatively normal. If tests reveal abnormally high insulin levels, a condition called hyperinsulinemia, along with insulin resistance markers, your body shows initial risk for developing diabetes. Lots of insulin in the blood also affects the production of lipids and lipoproteins, which are the small particles that are broken down from cholesterol molecules and fat products called triglycerides. These particles are small enough to travel in your bloodstream, but can be dangerous in large amounts when they build up in your blood vessels. In the presence of elevated levels of insulin, your body, especially your liver, releases bad cholesterol particles, such as VLDL, and the higher your insulin levels, the more bad cholesterol particles are circulating in your bloodstream, a condition called dyslipidemia. Furthermore, adiponectin, a hormone released by your fat cells that helps break down lipids, in particular free fatty acids, is often low in obese or insulin-resistant patients prior to developing type 2 diabetes. Such lipid and lipoprotein markers are traditionally tested to measure cholesterol. They also provide insightful clues on the extent of insulin resistance. After a while, the pancreas will become overworked and the special beta cells that produce insulin will begin to die. Some tests will measure how well your beta cells function and if they are showing strain. Beta cell dysfunction means that your body can no longer make enough insulin to help your cells take up glucose for energy, and high levels of glucose will remain in your blood, a condition called hyperglycemia. When insulin levels are low, your body may react in a number of ways. Some of the cells that use insulin to control glucose levels have the ability to store glucose. Liver and muscle cells will begin to release stored glucose when insulin levels are low in order to provide the body energy. Without adequate levels of insulin, in the presence of insulin resistance, more and more glucose is released into the bloodstream, and the effects of hyperglycemia are heightened. Markers of glycemic control are usually measured during periods of fasting when your blood sugar should be low. Test results that demonstrate consistently high glucose levels are the defining characteristic of prediabetes and diabetes. To summarize how diabetes develops, let's review the main features. High insulin levels mark the beginning of insulin resistance, the primary mechanism that leads to prediabetes and diabetes. Abnormal levels of lipids, lipoproteins, and the hormone adiponectin may further indicate insulin resistance. A drop in insulin production by the pancreas occurs from strain on the hormone-producing beta cells, and beta cell dysfunction eventually leads to an insulin deficiency. Without adequate levels of insulin, your body's ability to control glucose levels is disrupted, and glucose levels increase, defining the onset of prediabetes and diabetes. Too much glucose circulating in your blood, hyperglycemia, and too many harmful lipids circulating in your blood, dyslipidemia, are two conditions that are characteristic of prediabetes and diabetes. Left untreated, they cause serious damage to the blood vessels, leading to a variety of complications. Excess levels of lipids and lipoprotein particles can build up to create a plaque in your blood vessels. This is heightened in the presence of excess glucose molecules and free fatty acids. Due to blockage in your vessels, blood cannot circulate to your limbs, and the nutrients and oxygen carried by your blood cannot nourish your body's extremities. Buildup causes the vessels to expand and squeeze the nerves that course alongside them, leading to a condition called neuropathy. Damaged nerves can cause numbness and keep you from healing normally. They can cause your muscles to weaken and eventually atrophy, sometimes requiring amputation. And you may experience sensory changes, including blindness. Involuntary functions such as blood pressure and heart rate and even sexual function may become abnormal as a symptom of neuropathy. In large vessels like those supplying your heart and your brain, plaque buildup leads to a condition called atherosclerosis. Over time, the plaque can grow and rupture, which can cause cardiovascular disease or a heart attack, or in the brain can lead to a stroke. Atherosclerosis further contributes to end organ damage like kidney or liver disease.
I hope that helps you all understand at least the basics and understand that how, if we don't take care, it will impact on our overall routine and overall health parameters. Okay, so let me see if there are any more questions. All right, there are no more questions, and I think we have come to the end of today's discussion, behavior therapy. Do think about the small techniques I have suggested. I think kahin na kahin all of us know that these basic things are important, and these basic things will help us improve your health. Okay, and in case if you feel anywhere that any of these techniques you have applied in your routine and that will help you and your health, feel free to try them and share the feedback with your coach. On this note, all of us, let's do this Om chanting. I know I'm taking 5 minutes of your time, and I'm taking up trying to tell you all some activity, but I want just follow my instructions what I am trying to tell you all, and please follow that routine. Okay, yes, let's start. Yes, for all of those who are messaging me that they want the video link, they want the video details, don't worry. Your health coach will share it as a message with all of you with the webinar link. Okay. So once you get the webinar link on Monday by the end of the day, you will also receive the video link for this particular video. So don't worry, I am here to help you, and I'm glad all of you like the video. All right. So all of you, please close your eyes. Okay. Your palms should be on your thighs. Close your eyes, and you have to chant with me. Okay, the way I am going to chant. Be silent for 10 seconds. Keep your eyes closed. Again, start with the second chant. Om. Be silent for 10 seconds. Keep your eyes closed. Again, start with the chant. Om. 10 seconds. Be calm. Do not open your eyes. Remove your hands, your palms in front, rub them against each other, put them over your eyes, and now open your eyes. This is a simple activity. If you follow this, at least when you start your work day, when you start your stressful routine, or at times when you're not able to sleep or your sleeping pattern is disrupted, this is definitely going to help you. All right, great. I hope all of you enjoyed today's session. Please feel free to share your feedback of today's session with your health coaches. I will be very happy to take the feedback. Also, meanwhile, let us conclude today's session and meet next week with a new topic, new discussion, new set of knowledge sharing. Meanwhile, take care of your health, eat healthy, and have a happy weekend.